for you to have like a recording for the revision on the respiratory system. So I was just saying, in order to remind you and to be recorded, that you're going to review your grade 10 presentation of the cardiovascular system, and that we're going to start it on Saturday, inshallah, that we're going to focus on the ECG recordings, the valvular diseases, the ischemic heart diseases, and of course, related to the valvular diseases are the arrhythmias or the irregularities in the heart rate. I hope, by doing this, we would finish the cardiovascular system in half the time that was dedicated to it, and therefore we could have some time at the end of the semester to have a rapid review of the nervous system, especially about the diseases as we did last year, and it was a part that they all loved, and they found out that the nervous system was the best system they studied in human biology. The second thing I want to discuss with you is the quiz. Taban, you have received the grades of the quiz, and I didn't actually send you copies because most of the answers were incorrect. I know that there was an unexplainable controversy about the content of the quiz, since we agreed on the WhatsApp. But even though, even if we say that the content of the quiz was only the first part that was sent first, you didn't even answer this. And we were arguing that the content is more than what was agreed upon, although this was incorrect. Yet, even the first question that was related to the first content was not answered properly. It was even worse than the second one. So can you have an interpretation for this? I want to hear you.
I actually studied the second part مش أول part. يعني I know إن إحنا حضرتك كنت قايلة إن it's from 61 till 75، بس أنا I usually look at Google Classroom. يعني أنا كنت نسيت إن هي كانت مكتوبة في الواتساب، بس كنت فاكرة إن هي till slide 75. فلما فتحت Google Classroom it said from 68 till 75. أنا ذاكرت من 68 ل 75. فمن 61 ل
So you
68
studied the second part and you didn't study the first part.
بالظبط.
That's why you answered. It was the second part that was originally announced on Google Classroom, right?
Yes.
Okay, that's why. In the first question, Taban, you did most of the answers were incorrect. Okay, thank you, Mai. What about Yasin?
على كده دكتور الأخبار
الحمد
كله
لله.
تمام؟
تاني هتسلم عليا تاني؟
والله هو أصل هو مفيش غير مبرر واحد. أصل إحنا يعني مش هنضحك على بعض، يعني ما ذاكرناش كويس ده، يعني هو ده السبب الوحيد بس.
انتوا ما ذاكرتوش حتى البارت اللي كان متفق عليها من الأول؟
لا.
طيب, can I have an interpretation for not having studied for the quiz?
هو مفيش interpretation بس.
ما احنا we want to avoid a repetition of this, Yasin. We have to analyze the cause in order to know how to avoid it next time.
الكوز هو كان يوم Tuesday صح؟ خدناها يوم Sunday.
يعني بعد الويك اند.
حلو. كمان بعد ويك اند.
شفت ازاي؟ you have no reason صح؟
والله هو انا شخصيا يعني انا في اي سبجكت تانية ان انا اصلا اعمل هوم ورك قبل ما اجي سبجكت وكلاس ورك واعمله كويس وبتاع، ده كده بيجهزني تماما لاي كويز. بس المشكله ان حصل جاب كده في مره، فاحنا بقينا بناخد الكويز عشان احنا اجلناها مره، بقينا بناخد الكويز بعد ما بناخد الحاجه وبناخد حاجه تانية بعديها. يعني لما بناخد حاجه مع بعض ونعمل هوم ورك عليها، مش هي دي اللي بيجي فيها الكويز، بيجي فيها اللي قبليها. عارف كمان؟
ايوه بس الهوم ورك بتاع الريليفنت هوم ورك بتاع الكونتنت اوف ذا كويز has already been done. يعني انت لو بصيت عليه في 10 دقائق خلاص.
ما هو جه بقى بعد حاجه تانية. مش كان بيولوجي بس ما شاء الله اكبر، يعني في a lot of information قوي يعني.
يعني انت عايز تفهمني يا ياسين انه in the rest of the subjects you don't take a lot of information? Yes or no?
يعني
Just say yes or no. You take a lot of information in other subjects, yes or no?
ما بفكر اهو عشان اقول. ما هو الكيمستري مثلا ممنوع يعني، بقالنا كتير قوي في نفس الحاجه ما غيرناش.
ايوه بس اكيد انتوا في نفس الحاجه بس بتاخدوا new concepts every class. يعني انت
اكيد.
التايتل of the chapter is the same زي ما احنا التايتل is the respiratory system بس we take new information every time. يعني اكيد ده انتوا مش هتقعدوا doing nothing in the class، اكيد you're taking new concepts.
مظبوط طبعا.
طيب يعني انا I don't want to specify a specific subject بس اكيد in all subjects I know that all teachers work hard and give you a lot of information and I know the curricula by the way. يعني I know the curriculum of chemistry, I know what Mrs. Shahinaz covers and I know that there are new concepts that are being explained. فيعني مش عارف this is يعني أنا my interpretation يعني from my point of view إنه you didn't dedicate enough time for your human biology for a cause or another. يعني I don't know. أنا بالنسبة لي يعني since I did my part as a teacher طبعا I do care about you but if you don't care about yourself what can the teacher do for you؟ يعني if you don't care about your grades and you don't care about the knowledge you learn يعني what can I do بقى؟
لا هي مش قصه كير، او احنا طبعا كير، فانا
احنا
بالنسبه لي
عايزين
شخصيا
نحل المشكلة ياسين. يعني زي ما
انا
ناقشنا بعد امتحان السمستر ناقشنا ليه الجريدز ما كانتش كويسة واقترحنا شوية حاجات من ضمنها ان الهومورك يبقى بعيد شوية عن الحصة الديدلاين وانا نفذت ده. فبقى في بقى اللي انت بتقول عليه الشيفت ده بس الشيفت ده is no excuse لانه لو انت الفكرة كلها ان انت نسيت الكونتنت of the homework اللي انت عملته عشان خدنا a new class afterward. طب ما انت just look at the feedback يعني بص كده في 5 دقايق على الشيت هتفتكر الكونتنت كله يعني.
بس من غير اصلا ما نقعد مع بعض نعمل انالايزنج، انا اول ما يجي لي درجه وحشه ده اول حاجه بتيجي في مخي اكيد مش هتحصل تاني، يعني ده اول حاجه من غير اصلا ما نقعد مع بعض.
تحفة
يعني
دي.
حتى لو فتحت الموضوع ده تمام، اكيد الكويز تانية اكيد ده كده اكيد الكويز اللي جايه مش هتبقى زي اللي قبليها.
ما انا مش
ده حاجه
عايزه
مع
نمشي alternatively كويز حلو وكويز وحش كويز حلو وكويز وحش.
اه
كويز حلو
اه
فنطمن وما نذاكرش وبعدين نجيب نمره وحشه فنبتدي نقلق ونذاكر فكده هيبقى 50% of the grade على طول او at least you will lose 25% of the grade اللي هو الافريج بتاع 100% and 50%. تمام. طيب عمرو what's your طبعا هو رغم كل ده ياسين had the best answers. يعني رغم كل ده ياسين يعني هي مي لحقته في الجريد عشان البونس لكن هو ياسين essentially كان جايب اعلى نمره اللي هي للاسف يعني 9 out of 15 يعني.
لا حول ولا قوه الا بالله.
شفت ازاي؟
الحمد
طيب
لله.
عمرو thank you ياسين what's your interpretation يا عم؟
لا my interpretation is like Yasin كده يعني we did not work enough before the
يعني you
quiz.
did not have حتى even time to look at the answers of the homework and the feedback. وبعدين دول they weren't many slides. يعني حتى لو اتكلمنا عن السلايدز اللي هم الاوفرول اللي هم من 61 ل 75 دول 14 slides نصهم diagrams وكل سلايد عليه 2 or 3 sentences. يعني it's not a huge content. يعني they're not 15 pages مثلا on a textbook, they're just slides يعني. ف didn't you have enough time to review this small content يا عمرو؟
لا يعني
Yes
it
or
was
no?
not
Just say
around.
yes or no. يعني خلاص ما هو أنت
لا
interpretation is the same as Yasin's and أنت you didn't study enough, you didn't review the content. And I'm asking you one specific question. Did you have enough time or didn't you
we
have
review
enough time? And if you didn't
we,
have enough time, why didn't you have enough time?
يعني we reviewed the content but we did not study the content.
يعني you just read it?
Yes.
بس
يعني it
برضو
needed
يعني
more.
انت if you're mastering the content and you did your homework well and you understood the content well, just reading the content يعني could have allowed you to get a better grade. Anyways يعني I just discussed this with you لأنه I'm discussing it with you لأنه I thought إنه there was كده a reasonable answer يعني something that might make you excused. بس الحقيقة I don't find any excuse. Anyways, it's your responsibility. It's your baby. You have to take care of it. If you don't want to take care of your baby, then it's up to you. Don't. طيب today بقى إن شاء الله عشان ما نضيعش وقت we're going to do like a revision on the respiratory system and we'll be starting by the end of the slides or the second part of the presentation. I'll just stop sharing and reshare so that you can see the editing. We will start by pulmonary tuberculosis. My first question is pulmonary tuberculosis an infectious disease, yes or no? You're going to write the answers, please, in your notes. Sorry, the questions and the answers, of course. So my first question is, إيه ده وإحنا عندنا pneumonia on the slides. أنا ناسية الموضوع ده خالص. طيب, anyways. Is pneumonia an infectious disease, yes or no?
pneumonia ولا tuberculosis؟
Sorry, pulmonary tuberculosis.
Yes, it is an infection.
Very
disease.
good. Yes, it is an infectious disease. Who can explain why it is an infectious disease?
Because it is caused by a certain bacteria.
Yes,
The bacteria is
yes,
usually
very good. What's the bacterium, May?
Mycobacterium tuberculosis.
Yes, very good. So it is caused by a bacterium, Mycobacterium tuberculosis. So most probably it is an infectious disease. لأنه most bacteria are infectious. An infectious organism is an organism that is capable of causing infection. Okay, but the third question will be, are all types of pulmonary tuberculosis infectious? And you have to justify your answer, whether yes or no.
No. No عشان
Why?
اوكي لان في primary tuberculosis وفي secondary tuberculosis.
Okay, very good. Excellent.
تمام.
So, excellent. Not all types of pulmonary tuberculosis are infectious because, as Yassine said, there are two types of tuberculosis, primary tuberculosis and secondary tuberculosis. تمام. Amr, which of them is infectious, primary or secondary?
Primary.
This is the infectious one. Why? Justify your answer.
Because يعني it is spread through يعني carried by air.
What is carried by air?
The bacteria is carried by air.
Okay, bacteria are carried by air in which form?
In droplet form.
Yes, very good. Droplet form. And droplets are droplets of what?
Droplets of mucus.
Droplets of sputum. Yes, droplets of sputum. Okay. But does primary tuberculosis involve the formation of sputum and coughing sputum? Yes or no?
No
Coughing sputum? No.
No. So can it be an infectious disease?
No.
Okay. So primary tuberculosis is not infectious. In most cases, of course, there are no absolute facts, يعني, لكن in most cases, primary pulmonary tuberculosis is non-infectious. Why بقى? Because the infection is, how do we describe the infection of pulmonary tuberculosis when the patient does not produce sputum and does not cough sputum? It's only dry cough in pulmonary tuberculosis. How do we call that type of lesion in contradistinction with the one that occurs in secondary tuberculosis? In secondary tuberculosis, there is productive cough. And by productive cough, we mean that the patient not only coughs, but produces sputum, okay? So in primary tuberculosis, there is dry, non-productive cough. Dry, non-productive cough. But in secondary tuberculosis, we have productive cough, meaning that the patient not only coughs, but produces sputum. So how can we describe the infection in primary tuberculosis and that in secondary tuberculosis concerning the formation of sputum? Which of them is a closed lesion and which of them is an open lesion?
Primary tuberculosis is a closed lesion.
Yes, very
Secondary.
good. Yes, and the secondary is an open lesion. Okay, so in primary tuberculosis, the lesion is closed, meaning that there is just inflammation of the lungs. There is no formation of sputum. There is only cough without formation of sputum. It's non-productive cough, and it's a closed lesion. In secondary tuberculosis, it is an open lesion, meaning that there is a cavity. So the main difference between open and closed is there a cavity or not? If there is no cavity, then it is a primary lesion. If there is a cavity, then there is an open lesion. There is sputum formation, and the sputum is expelled during coughing, so we call this a productive cough. Did you get the difference between the two? Did you know which is infectious? Is
Yes.
that okay? Type. Let's move on. What's common in the symptoms between primary tuberculosis and secondary tuberculosis? What's common between the two amongst the symptoms?
Coughing.
Coughing, very good. What else?
Are
there any systemic symptoms? Are there any general symptoms?
yes طبعا. Fever loss of weight.
Yes.
Anorexia.
Very good. Loss of weight. What else?
Anorexia. Night sweat.
Anorexia, very good. What characterizes the fever, Yasin?
Temperature.
لا يعني is it high fever ولا low grade fever?
Low fever.
Yes, very good. It is a low grade fever, meaning that it is 38.8, 38.9, maximum 38. طيب, is there anything that is characteristic about the diurnal variation? Sorry. About the diurnal variation. By diurnal variation, we mean variation between morning and night or evening. So is there any kind, I'm writing it on the board, diurnal variation in the pattern of fever? Is it more in the morning or more at night?
Mostly at night.
Very good. It's night fever. Very good. And what else? What characterizes the fever other than being night fever?
The sweat.
Very good. The sweat. So it is night sweat, night fever. These are the characteristic symptoms of tuberculosis and that are common between primary tuberculosis and secondary tuberculosis. Okay. Why do we all the time say pulmonary tuberculosis? Why don't we just say tuberculosis?
عشان في other types of tuberculosis.
Excellent, because there are other types of pulmonary, other types of tuberculosis, like what?
في بقى tuberculosis في another places.
What are the famous places for tuberculosis to occur in?
Kidney and liver.
No, don't invent biology, Yasin. If you don't know, say no, or just say silent. Stay silent. Now we said, there are three major sites for tuberculosis. The lung is one of them and is the most famous, but there are other sites. The other sites can transmit the infection to the lungs. What are they?
Brain.
Sorry?
The brain.
The brain is a final step. The brain is a complication. يعني brain tuberculosis طبعا might occur. Tuberculosis of the meninges can occur. And it's if it occurs, it would be a very serious condition لأنه it might lead to death of the patient. لأنه, as you know, that treatment of brain diseases is difficult because of the presence of, I don't know whether we discussed this before or not, the blood-brain barrier, meaning that it's not easy for medications to pass from the blood to the brain. It is essentially a protective mechanism for the brain, that's true. But meanwhile, it makes the treatment of cerebral diseases or meningeal diseases very difficult. No, actually, the primary sites for tuberculosis are the skin and the small intestine. So we have skin tuberculosis and intestinal tuberculosis. Do you remember when we talked about how we can get intestinal tuberculosis? How we can get it? What's the source of infection? يعني احنا عرفنا the source of infection of pulmonary tuberculosis. Yes, ياسين?
واحنا اتكلمنا ان احنا بناخد فاكسين.
Yes, how do you call the vaccine? How is it named?
BCG.
BCG. Yes, very good. BCG.
An attenuated vaccine.
An attenuated live vaccine. Very good. Meaning that it is a living bacterium, but that is weakened. But this is not my question, Yasin. But anyways, before we answer my question, what's the risk of having an attenuated vaccine and not a killed vaccine? Yani, what are the benefits and the risks of having an attenuated vaccine? لأنه في حاجة تانية اسمها heat killed vaccine. So there are positive aspects for having a live, actually it is a live attenuated vaccine. We studied this in grade 10, and there are drawbacks for attenuated vaccines. Guess what could be the benefits and what could be the drawbacks?
اكيد الدروباكس ان هو ممكن ينفكت بقى يعني.
Very good. The major drawback is that the BCG vaccine, being made of a live attenuated vaccine, can actually cause the infection. When can it cause the infection? If what?
لو تغلب على الاميون سيستم على حسب الاميون.
Excellent. Yeah, and you deserve a +1 now, Yasin. So if your immune system is, or the immune system of the baby, actually of the newborn, and we give it at 1 month of age, if the immunity of the newborn is weak, then the presence of a live attenuated vaccine can actually cause the infection of tuberculosis, طبعا at an age that is too young to fight the disease. طيب, Amri, you raised your hand. What did you want to say? Did you want to talk about the drawbacks or about the benefits?
Both.
طيب, just go ahead.
Yes. I wanted to say that the benefits are, and it will help يعني increase طبعا the immunity, and بس برضه the drawbacks if it is يعني if the immunity is not strong enough to fight it, it might cause the person to attract or to get infected.
Yes, very good. So you mean that the live attenuated vaccine can stimulate the immune system more than the heat-killed vaccine. Then it's actually living. It consists of living bacteria that have been weakened, but the heat-killed vaccine consists of completely killed bacteria. Yes, very good. We come back to our question, which is, how can we get or be affected by intestinal tuberculosis? What is the source of infection? Do you see the slide? طيب, why don't you read the information on the slide?
بسبب الباسترايزيشن. لو احنا لو ما عملناش
لا ياسين, pasteurization is a process of sterilization of milk. This is how we can avoid intestinal tuberculosis. So what's the source of infection in case of intestinal tuberculosis?
unpasteurized or يعني unsterilized milk.
Yes, very good. Unpasteurized milk or unsterilized milk or infected milk, just infected cow milk or buffalo milk or whatever kind of milk. Okay, very good. Now, how can we avoid getting pulmonary tuberculosis? Mai, how can we avoid getting pulmonary tuberculosis?
We can avoid getting pulmonary tuberculosis by doing achieving good hygiene
Very good.
and taking the BCG vaccine.
Very good. What else? What do you mean by achieving good hygiene? Give us 2 examples related to the content we have just said about taking care of good hygiene. What would you say?
To sterilize everything, sterilization.
Yes, you cannot sterilize everything, actually. You cannot sterilize your whole life, Yamai. على فكرة, by the way, it's not healthy to sterilize everything, because once you go to a place that is not sterilized, you will be the first one to catch the disease. So we sterilize milk, yes, and we take the routine measures of infection control, like, for example, if you wearing a mask, for example, if you go visit somebody who is tuberculous, or if you go to a chest hospital in general, by the way, لأنه chest hospitals are a very serious place and very liable to transmit infection, and of course the BCG vaccine. Now let's come back to or return to the pulmonary infection of tuberculosis. What's the preferred site for tuberculosis infections?
Alan?
Where in the lungs does the microbe live the best?
Oh, in the lungs.
Where in the lungs? Yes, where in the lungs? In which part? Yes, Amr.
Is it in the يعني the alveoli?
How it is, not inside the alveoli. It is in the tissues around the alveoli, but in which part of the lung?
وانا يعني كاكس راي
وانا
وايز
بس عايزه اسال سؤال، في سؤال محيرني يعني. هو انتوا if you don't have a homework assignment on a particular part, we haven't yet had a homework on pulmonary tuberculosis, does this mean that you don't study the slides? يعني you study only when you have homework?
لا طبعا، ازاي احنا واخدين نوتس جامده جدا حصه
ايوه
فاتت.
واخدين نوتس بس قريناها حتى؟ ما واضح لا، ما ذاكرناهاش اصلا يعني. طالما ما فيش كويز، طالما ما فيش شابتر تيست، يبقى احنا مش هنذاكرها.
لا بس هو في شابتر يعني.
يعني بس
يعني
الشابتر تيست متاخر يوم الثلاث and that's why I didn't give you homework. بس it seems انه it is essential now that I give you homework. يعني انتوا اللي جبتوا لنفسكم بصراحه. It's okay. طيب it's in the apex of the lungs. In the
ايوه،
apex.
بقول كده حالا، بقول ان اكس راي وايز، يعني لما بنلاقي فين في الاكس راي بيبقى فيه اوباسيتي، بنلاقيه في الايبكس.
ما هو الاكس راي reflects the anatomy and the pathology ياسين. يعني هو if the x-ray shows you the lesion in the apical part يبقى هي tuberculosis affects mostly the apical parts of the lungs. Okay. يبقى in the apices. The plural of apex is apices. You know how to write it? ازاي طيب؟
اي بي.
ها؟
حضرتك كملي. انا
حضرتي أكمل؟ طيب APICES. APCs is the plural of apex. تمام؟ يبقى it is in the APCs and it is usually unilateral. Unilateral. So if you have a lesion at the apex of one lung, together with the systemic symptoms, because I might ask you on the test, how can you diagnose a case of pulmonary tuberculosis, حتى لو هي primary, يبقى mainly from the symptoms and from the chest x-ray. The symptoms, you have a patient who is debilitating, who is losing weight, who is anorexic, who doesn't want to eat, who has night sweat and night fever. And that's why when the patient comes to your clinic telling you that I'm suffering from fever, it's not only important to know the onset, because was it an acute onset or a gradual onset? and the duration, was it a short duration in acute cases or a long duration? But it's also important to ask about something very important, which is the pattern. Pattern, yani, is the fever continuous or is the fever intermittent? And if it is intermittent, yani it drops every now and then, is it related to the medication? Walla it drops on its own. So this is one thing about the pattern. The other thing about the pattern is the diurnal variation. Yani does it increase more at night or not? Because this is very important to diagnose a case of tuberculosis. What does this X-ray show, or what are the abnormal radiological findings that you can see on that X-ray? Or actually, what does the arrow point to? May, what can you see in the right lung?
I can see that there's in the upper in the upper part it's a bit white than the other
How do we
lung.
call whiteness of the X-ray?
Radio opaque.
Very good. So you can see a radio opacity. Where? In the right lung. And where exactly in the right lung?
I can see it يعني in the يعني هي right lung هي ناحية الحتة بتاعت الفيفي صح؟ عشان
الرايت
بتلخبط
لانج هي اللي فيها الارو. مش انت شايفه
Apical.
السلايد؟
ايوه انا دايما
يعني
بتلخبط فيها.
انتوا اكيد شفتوا الموديل بتاع اللونجز وعرفتوا ان الرايت لونج عباره عن 3 لوبس. فانت عندك an upper lobe وبعدين عندك a middle lobe بعدين عندك a lower lobe. فهي it lies in the upper lobe. بنسمي الجزء ده the apex of the lung. The apex of the lung. تمام؟ فهي لو انا if I ever ask you to describe the lesion, you would say an apical radio opacity, an apical radio opacity in the right lung. بس ده مش هيعفيكم من ان انتوا تقولوا بقية الكاركترستكس. يعني you have to read the X-ray in a systematic way. يعني you have to report on the costophrenic angles, and you have to say that both costophrenic angles are clear. So we have clear costophrenic angles. This is one thing. You have to mention that the left lung does not contain any abnormality. You have to also comment on the bronchovascular markings. يعني هنمشي بنفس systematic way اللي كنا بنمشي بيها في البلورال effusion وفي pneumothorax. This is the systematic way. طبعا this is the simplest form. يعني if you are a medical student طبعا you will give more comments, more systematic points on more structures. طيب لو كلمنا عن bronchovascular markings, which lung has more pronounced and obvious and exaggerated bronchovascular markings? Is it the right lung or the left lung?
The left
اللونج
lung.
فيها الابيكال ليجن اللي فيها
بالظبط كده. The lung that contains the apical lesion or the apical radio opacity, and it is the right lung. Does it sound logical?
Yes,
Why?
it's actually visible كمان.
Sorry, Amr?
It's visible.
ما it's visible. أنا بسأل هل منطقي إن الناحية اللي يكون فيها الليجن بتاعة الtuberculosis تبقى having more bronchovascular markings than the other؟ هو البرونكوفاسكولار markings دي لما تبقى exaggerated يبقى البلاد vessels أخبارها إيه؟ congested ولا non-congested؟
نون كونجست.
لا هو congested يعني full of blood. هم لو non-congested يا ياسين مش هتشوفهم. يعني when you have visible مش visible ما هم دايما visible بس when you have exaggerated bronchovascular markings that extend beyond the inner 1/3 of the lung. مش هو لو نفتكر مع بعض يعني ايه exaggerated bronchovascular markings؟ يعني they extend to more than the inner third of the lung. صح؟ يعني هنا ادي ال inner third of the lung، فهم they extend beyond the inner third of the lung. يبقى معناها انه the blood vessels are congested، معناها انه the blood flow is increased to the area, and this is normal because there is a process of inflammation in the lungs. ده غير بقى ان الاوباسيتي اللي انتوا شايفينها هنا دي ممكن يكون فيها lymph nodes كمان، بس احنا مش هندخل في الموضوع ده. اخر سؤال بقى related